her, bold, brave, her, with Dr. Pam Peak.
Hi, I'm Dr. Pam Peak, and this is episode number 519 of the Bold and the Brave Her podcast. Today, I'm joined by Dr. Andrea Klemes. Oh, you're going to love this one. Why? Because she represents leadership in a brand new trend in the United States. It's all about concierge medicine. Dr. Klemes is the chief medical officer of the largest concierge group nationwide in the USA, and that is MDVIP. And she serves as the executive and organizational leader of MDVIP's medical advisory board, and it all supports the quality and innovation in the delivery of this healthcare model. Oh my gosh. And it really draws from the expertise from all of the affiliated doctors. Dr. Klemes, welcome to the Her podcast.
Well, thank you for having me, Pam.
Okay, now, Andrea,
yes,
just exactly what the heck is concierge? Where did this come from? I mean, we have like 280,000 primary care physicians in the United States. They're out there doing their thing, but the total number is kind of like, decreasing. It's like, people are going into specialties and whatever. And there's just been this emerging change, like a tidal wave that's been, really kind of gurgling along for a while, and all of a sudden it exploded. And there's a changing face of how medicine is delivered today. So, tell us what that's all about.
Sure. So about 25 years ago or more, there were some innovative physicians who, thought there have to be better ways for primary care, especially when, as you know, because you're like the poster child for fitness and taking care of yourself and all. And doctors traditionally have really just interacted with you when you're sick, right? They haven't been a partner in your health forever. Years ago, when MDVIP started, one of our founding physicians was in the office. His patient came in, patient waited in the waiting room, came back and said to the doc, "Hey, oh my goodness, it's horrible out there." The doctor said, "If you think it's bad out there, you should see what it's like back here. We don't have the time to focus on wellness and prevention. All I can really do is change your blood pressure med, order a few blood tests and get you out of here." And so from that insight, we had some very smart physicians and other founders who developed MDVIP. Now, I'll usually say we're personalized preventive care. But the way the model works is that a patient pays an annual fee to get like an executive style physical. And then your doctor, because they've shrunk their patient panel, has more time for you and has this executive style physical that they can review with you and focusing really on wellness and prevention. And then they can follow up with you during the year. There's one or two other companies that started doing this 20 years ago like we had, but we have grown since we started to over 1,400 physicians and taking care of like 425,000 patients across the country. The only other thing I would say is, when people use the word concierge, they conjure up white fluffy towels and getting me tickets to a Broadway show in Manhattan. That's not what we're about. We are really about physicians who want to help you live your longest life, your healthiest life, improve your health span, not just your lifespan. And so that's why they have the time and the testing and can really take good care of you.
So, in all transparency, I asked Andrea to come on board and describe from her level of expertise in corporate leadership what Concierge was all about, because I kind of fell into it. So when MDVIP actually began, which was, my Lord, 25 years ago, I was with a fantastic physician who, my family just loved. I mean, I'm sorry. He was just absolutely fabulous. Then one day I got a little email, as well as a nice call from him because we're good friends, as, doctor to doctor. And he said, I'm going to be joining up with a group called MDVIP because I really want to deliver, better care and more personalized care. And it will involve an annual membership, but it's something I consider to be very important. And what's really interesting is, I talked to him about it, at length. And he already knew I was going to follow him to the ends of the earth anyway. So, if he said, give me your firstborn, I go like, yeah, you can have him, not a problem whatsoever. But, we shared some information, and that is the typical primary care physician has a ratio of 2,500 patients to one doctor. And I almost fell off my chair because I didn't realize that. It can be as high as 3,500. So that's another 1,000. And, if you divide that up, into a year and how many people you could actually see in a day, that gets kind of funkadelic. And so I guess I hadn't seen the updated numbers. So when it comes to physicians, I can understand, why they would want to see a more limited number of patients so that they can give those patients the kind of care they were trained to give, which was, of course, high-level care, personalized care, that really all of medicine is really going to now. We always talk about individualized, customized, and all the rest of it. So, truth be told, as soon as we had a conversation about that, I just said, where do I write the check? All right. So I did. And for all these years, I've experienced what the concierge medicine is about. And I got to tell you, when we go through the little bits and pieces of what it involves, it's really cool. Now, I'm going to say right up front, right? One of the biggest challenges is not everybody can afford it, and that's a tough challenge, and it's something that it's so interesting. I'm not sure if you saw this, Andrea. I just read it this very morning. But Bobby Kennedy, with the administration, has noted that as part of some of his preliminary plans is he wants everyone to have, as it were, a concierge medicine experience, meaning more doctors who are spending more time, especially with preventive care. So I think that this whole issue of equity, is going to be addressed gradually. What do you think?
Yeah, I mean, your health is a choice, right? You can invest in your health care, or you can invest in a gym membership, a yoga membership, your Starbucks, Dunkin' Donuts. I have to be equal since people on either side of me favor one or the other. But it's really about what do you prioritize in your life. And so many people, there are definitely some who can't afford $2,000 a year on top of everything else, especially on top of insurance premiums and all. But if you prioritize it and you are that way, I mean, people always say, well, you're making a two-tiered healthcare system. I'm like, there's already a multiple-tiered healthcare system. So we're just trying to help the most that we can. And the physicians, it really started because physicians were frustrated, right? That they couldn't take really good care. I can remember the days of being in practice and, you lay down at 11 o'clock at night and you're like, oh my God, I forgot to check on that blood test today, right? And then you start stressing. And when I say that to doctors today who are not in MDVIP yet, they all say, oh my God, that happens to me all the time. And this is really about taking really, really good care of about 600 versus care of thousands. I even heard somebody the other day, they had 8,000 patients in their practice and they see 60 a day.
That's like running, most of my background is in critical care. And so that's like running them in and out in critical care because, you're not there to make a buddy in critical care. You're like in and out, let's deal with it, let's solve the problem next, and that type of thing. But in primary care, there's a lot of lip service that's given to, you really do need to be spending a lot of time talking to your, provider about your life and in 11 minutes. How does that even happen? You can't do that. I noticed that, when my own provider, switched over, I saw that he was less rushed. He was less, kind of looking at the exit and knowing that he's got 6 more to go and whatever.
Doorknob questions, right? Your hands on the doorknob, and then
the doorknob
because they don't get to you.
Oh my God, there's no question about it. So, just looking at the physician end of it, I think one of the first reasons why a lot of physicians are actually choosing to do this is they want to practice medicine the way they originally envisioned.
And that was,
and you're tired of running the traditional primary care business, especially as it relates to admin and the medical records and all the other stuff. How is all that handled in something like MDVIP?
Yes, so when you only have 400, 500, 600 patients, the insurance paperwork, the prior authorizations, all those things are much less. Most of our practices have less staff, but the staff know you as well as the doctor. So things are easy. The other easy thing is doctors can call you back during the day. My husband was one of his people who worked for him. Was like, oh my God, I have this great doctor. He called me back at 9:00 last night. My husband goes, you don't realize that that's a problem, but if they're calling you at 9 at night, it's because that's when they're just getting to calling you because they don't have time during the day. In our practices, doctors can call you back in the morning. If you call, you can text. I text my doctor and I'm just like, I think I have another sinus infection. Do you want me to come in or what do you want? And she texts me back, and I know I have a little bit of clout being an executive for the company, but they do the same for you, right? I mean, that's one of the things when you have that close relationship and you can get things out. I've had stories, many of them from doctors who in this model who have said, I couldn't get patients' chronic conditions under control. And actually, I have a story from your doctor that he told us that he had a woman he took care of for years and he couldn't get her chronic conditions, her diabetes and her blood pressure under control. And he moved to MDVIP and he still couldn't. And one day he sat there with her and he said, I don't understand. And his personality, right? He said, I don't understand. I've been trying to help you for years. What's going on? And she finally looked at him and said, I'm going to tell you something I've never told my husband or anybody. I was abused in the concentration camps. And when he got his foot in that door, it opened up Pandora's box for him so then he could help her deal with that so she could deal with her issues. If you don't have that close relationship, if you don't feel like the doctor has the time for you, you are not going to tell them everything that they really need to know.
That's a very telling story. There's no question about it. And that relationship, it's really interesting. I'm going to sort of throw this out there. So in the days of Dr. Marcus Welby, and that is, the traditional sort of family physician, oftentimes showed up at your house and, everyone knew everyone. And that physician, was with you for years and years and, already could finish a sentence for you. And that's how cool it is. And then all of a sudden, we just started becoming more of a business. And we saw less and less of that, less prioritization of that type of a relationship. And many of us who remember that kind of thing as like little kids and whatever, really missed it. And it's interesting that this concierge medicine movement seems to be going back to that, because you're including also telemedicine, which I really appreciated because, during COVID, I had multiple conversations, every now and then, just sort of checking in, making sure that, with the whole craziness going on and everything. So that was the first thing. And the other one is that they actually, could do some concierge medical groups actually even do a home visit. It just depends upon, whatever kind of, model that they're using. But I see that the MDVIP doctors can have good flexibility to be able to kind of do something like that. So I, see that. Then there's a third reason I think a lot of doctors do this too, and that is they're burned out. And I think a recent studies showed that at least 63% of doctors across the country have at least one symptom of burnout. And, clearly a lot of that got really bad during COVID for the obvious reasons. But it's interesting. The other thing to keep in mind, and tell me if I'm wrong, but it's not that the concierge doctor has a job that's easier. It's just that you have fewer patients, but you put more effort and time into those patients. So instead of 3,000 patients to one doctor, you have anywhere between 300 to 600 with one doctor. And so that means that with each patient, you could spend more time, correct?
Yes. I mean, I liken it as, you're not running. Our doctors will tell you all the time, I'm not running through the day anymore, or like running on a treadmill, but I'm walking through the day. I can call a specialist in the middle of the afternoon to ask a question as opposed to sending the person to a specialist. We've done some surveys over the years. I just did one recently. It was with consumers, not MDVIP patients. We actually asked consumers and physicians two different sets of questions. And the physicians, we asked about burnout, and many of them said that over 75% of the time, they have knee-jerked to writing a prescription or sending to a specialist as opposed to coaching on sleep or diet and exercise because it's easier and it takes less time. Whenever I do interviews, a lot of the time we'll talk about the rule of threes. It takes 3 weeks to get an appointment, 3 hours in the waiting room, and you get 3 minutes with the doctor. And it's a bit of an exaggeration, but that's how many feel. So to your point of less patients, it's also when the doctors aren't running and aren't stressed and aren't burned out, because yes, Mayo Clinic's been putting out articles yearly for years, and primary care docs are like up in the 50% burned out, not even one symptom, just burned out in general. And when they are, you don't have time to probe on the little lady whose, diabetes isn't under control. Another great story, and this is from one of our founders, 50-year-old exec came in doing a physical. You and I have done this a million times, right? Head to toe. And they were going down, any visual problems, any breathing. Do you cough? Do you have a cough? And this executive said, not really. And my doctor says, in my old world, not really means no, because I have no time and I keep going. But not really in MDVIP meant, whoa. When do you cough? I cough when I exercise. It's really kind of weird. Well, and you asking more questions, it ended up that cough was his anginal equivalent. And he ended up having bypass surgery the next week because they got him right in for a cardiac cath. You never would have found that. He would have been the type who would have dropped dead in the park, right, as he was running. But you never would have found it if the doctor didn't have the time and the wherewithal to think, and not, to your point, trying to get them out the door because I have, 30 more to see. And that's the only way I can do it, is keep circling these, increase the throughput. It's what the hospital systems will say. Increase your throughput so you can increase your billings, because otherwise we can't keep you solvent. Because as you know, the reimbursements keep going down. So as the reimbursements go down, doctors see more patients to keep their doors open. And that doesn't work for patients or doctors, just the insurance companies.
So speaking of insurance,
I shouldn't have thrown that word out, right? No, I'm kidding.
Well, no, but what I found was that, um, what I found was that the insurance companies, I mean, Medicare will cover whatever Medicare covers, when it comes to lab tests and, that kind of thing. And then after the age of 65, you know, many people have secondary insurance as well, which kind of kicks in to be able to help things. So the issue of insurance is an interesting one, and it's rather varied when it comes to this concierge medicine situation. And I think that for everyone out there considering using concierge, ask questions like, okay, so what's inclusive of the annual fee? So I get an executive physical. Okay. What about those labs? Okay. So they'll go to my insurance company, and that's good. And then, you have a better feeling for what you're actually paying for. Does that make sense?
Yes, and there are different models. The way MDVIP has sat on this legal and regulatory framework, that's why we can take Medicare. I mean, Tommy Thompson, when he was head of HHS, said, this sounds like a great model. This is great. And it's compatible with Medicare because we don't violate any Medicare laws or government laws or anything. That's why the membership fee goes for this executive physical that I actually put together to wrap around what's covered to make that yearly physical very robust. But there are concierge practices that don't take any insurance. And so then you have to worry about having insurance premiums on top of it, because what if you end up in the hospital? You need some coverage. There are practices that do direct primary care where you pay a fee and you get all your primary care visits included. They don't take insurance. And then there are those, if you want to say those high end, where they're charging, somebody told me about a doctor in New York that charged $60,000 a year and all you get is the doctor. No executive physical, nothing else. And then, you have to pay for everything else, and they don't take insurance. So it's to your point, do they take insurance? Do they not? What is really included? And I think the other thing is, does the doctor only practice this way? Like MDVIP physicians only do MDVIP. There are other models out there which I'm not really too sure about the legality of, but that have a concierge practice and a regular traditional practice next to each other with the same doc going back and forth. To me, that violates Medicare law or government laws because you can't treat Medicare patients differently in your same practice. So to me, that doesn't work. But if there are physicians out there doing that, you just have to find out, are you paying $2,000 and you're getting taken back the same time as the person who's in the traditional practice who's not paying? And what are you getting for that? And is that worth it to you? Or do you need to find, another physician or a different kind of model?
So I think that, again, this is also becoming a bit of a Wild West out there. So you've got the big monster institutions like Mass General, Mayo Clinic, and others who have their own concierge systems, programs. And what you buy there is something interesting too. Another nuance, you buy the system. So once you're in, like the Mayo system, once you're in the Mass General system, literally what they'll say is, you'll see your concierge primary care person, and then it turns out you really need to see someone in GI. They'll write a referral immediately. There'll be a scheduler right there, and you'll get right into GI without even blinking an eye. And you're in a system. You bought into a system. That being said, those tend to be the most expensive models, and those are all 5-figure models. So you're spending a lot of money, but you're doing that to stay within a system that you believe in. So that's another way to look at it. If you if you've got the money and the wherewithal and the whatever, I personally found that, for a fraction of that cost, MDVIP physicians are extremely well networked with this subspecialists in the field. And I remember when, my physician would literally just pick up a phone and call the subspecialist or have his, PA or nurse practitioner do it. And boom, before I left, I already had an appointment and I was kind of ushered through. And that helped. So I don't have to be part of a monster. Does that make sense?
It does. And we have a department that reports up to me. It's called the Medical Centers of Excellence Program. Now, your doctor was close to Hopkins and he had his contacts there, so he could just get you in. But say, I don't want to pick you, so say an MDVIP patient has pancreatic cancer and the doc wants them to go to the top person in the country. Well, we have relationships with MD Anderson and Sloan Kettering, and my team will actually speak to the doctor, speak to the patient, and then speak to our contacts at those systems to get you to the best doctor you can. I'm a physician, you are, we went through training. We know that the residents and the fellows need to learn, but when you're an MDVIP patient and you want the best of the best, you don't want those. So we make sure you're getting the head of the department, the world-renowned specialist on pancreatic cancer, whatever it is. And we have relationships with all those major hospitals across the country or hospital systems, Mayo, Cleveland Clinic, all of those, Hospital for Special Surgery and others. So that the other thing is the specialists all love our patients because your doctor had the time to work you up and really figure out up until the point that they need the specialist, as opposed to those knee-jerk referrals to a specialist. You call Hopkins and say, my patient has a headache, will you see them? They're probably going to say no, because did you figure out what kind of headache? What do you think is wrong with them? Do they have a brain tumor? Do they have, something else wrong? So local specialists love patients because they really know that they've had everything done and they're there because of their specific reason and it's the right reason. And then we have those tertiary care centers that we can get you into. So, it's not all your care is at Mass General, and some people want that. But if you're in Boston, and you're at an MDVIP doc there, we can still get you into all those same places.
The Her Podcast is sponsored by Solaray Vitamins, Minerals, and Herbs, all rooted in nature. In addition to women's multivitamins, Solaray, Solaray, is presenting the new Her Life Stages products, providing support for the menstrual years, including PMS, perimenopause, menopause, and postmenopause, and even libido. This integrative, holistic approach has a woman's back throughout her entire life journey. To learn more about Her Life Stages, you've got options. You can run on over to your local health food store or check it out at Whole Foods, Sprouts, Amazon, or scroll over to solaray.com and use promo code HER20 for 20% off your purchase. Women, Solaray's got your back. I gave a talk, actually. It was a TED Talk on Wall Street. And it was one of the most fun things I've ever done. So I was standing on the New York Stock Exchange's stage. I was the first physician and woman to ever do that. And we were having a real wild and crazy TED Talk series. And in my case, believe it or not, it was, one of the big themes that I wanted to touch upon was health is wealth, wealth is health. Basically, and to your point, when I brought up the whole issue of, having to pay and whatever, if you think about, let's just round out the number, $2,000, what do you really spend money on all year? Right? How much, kind of easy stuff you could cut out that honestly does not contribute to your life and survival and health span. And if you were to have a little piggy bank and sort of put that money in there,
Right.
what would it equal? Now, if I was saying like it's 100,000, well, okay, fine, that's a lot of money. But $2,000, I want you to think about that. What else could you reprioritize potentially so that you could actually access? And this is an interesting question. Again, I am exquisitely sensitive to the fact that so many people, are just having trouble, getting through the day, holding down two jobs to be able to make everything work. I'm hoping that when the administration, executes what they want to do with the delivery of healthcare nationwide to everyone, that so many of these issues are answered. In the interim, if you want to look at something like Concierge, then you just ask yourself, where could I just cut away at certain things that I just honestly, I was talking to a colleague about this, and she said, honey, I could do that with just Starbucks alone. I mean, it's not just the, monster sized lattes. It's also the Mount Saint muffin that you keep chowing down on. And when you do the, ka-ching, ka-ching, that's like, 10, $12. And especially nowadays. And then if you multiply that out almost on a daily basis, I think we're kind of there. And so I just sort of look at it like that. It's like a gym membership, like you said. A lot of people say, oh, $20 a month, that's a lot. Yeah. Well, let's go back to Starbucks.
Right.
What's your damn priority here?
Yeah.
What do you think?
Yes. I mean, definitely you have to think about, the other thing is healthcare is expensive, so that if you invest in it now, you'll actually spend less farther along. I mean, I've published multiple studies looking at our patients. We have less heart attacks and strokes in MDVIP patients. They've lived longer. We take better care of their chronic conditions. So all of those things together are going to save hospitalizations and medical issues in the future. So if you really just want to look at it as a return on investment, as an ROI, you're putting in a little bit now every year to keep yourself healthy. And not just healthy, you want to be able to live life and be out there enjoying life, right? You don't want to be in a nursing home for 15 years because you broke your hip and, you can't move anymore and you're just bedridden, right? That's not health span. That's just lifespan. So if we want to make sure that you can, get there. I mean, I have an 18-year-old, get there to see her, graduate college, be successful in life, hopefully have kids someday and get married, all those sorts of things. I'm an older mom. I have to make sure I'm investing in what I've been doing. And really in your 40s, as you know, this is better than I do, 40s and 50s. If you didn't start in your 40s or your 30s, you're not going to get to where you want to go. One person that I know that has horrendous genetics, 5 kids, one died sudden death at 60 of heart disease. 2 of the other boys have had bypass surgery. There's diabetes sprinkled everywhere. They've all, and there was a daughter who worked out a lot, but still had an A1C that was elevated, but nobody had ever told her it was because it wasn't screaming diabetes yet. And then the person that I knew, had been exercising since his 20s, ate very well, high stress CEO type, minimal, moderate drinking, nothing over. I think that of all those terrible genes in him, I mean, there's a National Geographic article kind of recently about all this, that he turned off all the bad genes, right? The expression of the bad genes, and it only expressed good genes going on, so that he is now 65, no evidence of heart disease, no evidence of diabetes, nothing. And it's not that he has killed himself over these years, but he has gotten the testing, followed along with a physician, partnered to be able to know what he needs to look for.
It's interesting. You mentioned age. So I think that if you're 20, concierge medicine is stupid. Because, when I was...
say that out loud, but
Yeah, I know. The reason why I'm saying that is obvious. It's like when I was 20, the last thing I ever wanted to do was see a doctor. And if you're a young woman, it's the GYN. That's all you're doing. And, other than that, my job in life, and it still is, it has never changed, is to avoid, the medical care system, except for being proactive, preventive, and then obviously when things happen out of my control, okay, an accident or, whatever might happen. So my goal in life is to have the world's thinnest medical record. I just want to have you flip the pages and it's like, okay, annual exam, each of the years goes by. But, when you're 20, the last thing on my mind was the fact that I was mortal. We're all immortal then. It's like, we're just going to do stupid things and take risks and, whatever. By the time he hit 30, like reality starting to settle in a little bit. The pregnancy may have been a deal, somewhere along the line kind of got you acquainted with the medical care system, whether you liked it or not. And suddenly your welfare and the welfare, of a little munchkin, it took on a brand new reality in your brain. And suddenly you realize that little one is going to watch you and your habits, and that's going to imprint on them. So if they see that you're physically active and you're eating great stuff and, you're trying to get enough sleep and you're meditating, I don't know, whatever the issue may be, then, they're going to take the cue and go, okay, well, that looks good by me. Bring it on, and whatever. So there's that. So I think by the time he hit 40, things really start kicking in. Suddenly, like especially with a woman, she's entering perimenopause. And whether you like it or not, you're going to be seeing physicians because you're trying to answer questions like my vision's going to hell. My weight's going weird. My skin is wonky, hello dermatologist. And then of course the GYN becomes your new best friend because you're trying to figure out what you're doing with menopausal hormonal therapy. And so what I see is a transitioning over the decades where at 20 you're immortal, 30 you're a little less immortal, at 40 you're getting big wake-up calls. And by the time you hit 50, it's like, whoa, as a woman, because this is her podcast, by the time he hit 50, you've got the menopause thing going on, post-menopause, and a lot of your lab tests are starting to look a little wonky. It's like, hey, my cholesterol was great, all along. All of a sudden, boing, as soon as the sex hormones say bye-bye, you got that. You see your bones reversing course because estrogen is such a great bone builder. And so who's going to have a conversation with you about menopausal hormonal therapy? Who's going to sit down and look at your unique and ever dynamic situation? Because what's cool this year may be changing by next year. So who's monitoring that? That's why I think that a lot of the people interested in Concierge skew a little older because, they're just getting wake-up calls. I didn't want any wake-up call when I was 25 or 35. I'm like, go away, leave me alone. I just have my GYN, I'm cool. But then in your 40s, it's like, whoa, wait a minute now. What's going on? Whoa, you read the inbox in your brain and it says, get ready for some changes. And you better know what you're doing. What do you think about this?
Yeah, it's funny because as I'm smiling and listening to you, but the sad part is today you needed to start paying attention before your 50s, right? And that's why so many of our doctors, we skew a little bit older, and a lot of the practices end up with Medicare age patients over 65 who already have the chronic conditions. Our docs love the younger ones that they can actually prevent not just the complications of diseases, but prevent the diseases themselves. I get a little passionate about this part. I keep thinking in my head, when you're talking about where the role models, I took care of a woman years ago for gestational diabetes and African-American, overweight. And after she had the baby, all was fine. And I kept following her because then she developed diabetes. She brought in her husband one day and her daughter when she was 5. And the husband was overweight. And the daughter at 5 years old weighed 100 pounds. And I was like, she's going to have diabetes by the time she's 10. Right. So whereas all those complications that we're seeing now, the heart disease in the 60s, all these things that are younger than they used to be. When I trained diabetes, we'd call it senile diabetes because you got it when you were older, remember? Well, now we're diagnosing 10-year-olds with type 2 diabetes. So that period of I'm still immortal is really shrinking when people really need to think about what's the family history, how am I eating now? How am I stressed out? Am I sitting on the couch and scrolling on my phone all day, or am I actually outside and getting some steps and doing something?
You know what I'm hearing a lot of, kind of piling onto that? A lot of people who are currently concierge medicine, patients in MDVIP, say, for instance, they're going home and they're spreading the wealth to the younger ones. And so if they have a 30-year-old child, they're going, hey, dude, listen, here's the truth. And you need to start hitting it now. And don't be waiting because to your point, I remember in med school when we called it adult onset diabetes. Remember? Adult onset.
Type 1 was juvenile onset, right? So there you go.
It's crazy. And at the same time, we're now seeing all of this happening. Well, obviously, obesity, or I guess we call it diabesity now, is so rampant that we're seeing this. It just breaks my heart when I see children and adolescents. And then I look at the statistics that if you are an obese adolescent, basically it's 100% chance you're going to be an obese adult. But if we can capture them when they're children and turn it around, and set up a brand new foundation of health and wellness, then they don't have to face that kind of a future at all. So I hope that more and more of the current concierge patients take all of this, information home, share it, and really help inspire and guide. And then obviously it'd be great if we can get more and more into a personalized, individualized program like concierge medicine earlier, because it's so worth it. Also, we're time starved. Doctors are time starved. We're doctors and we know time starved, but so are people. They can barely find enough, they have to schedule breathing at this point. And so I really think at the end of the day, that, what's going on is that people are beginning to value their time. And we go back to the health and wealth thing all over again, which, your true wealth is health because it's priceless. There's no number associated with it. It's not worth a billion or $1 trillion. No, it's priceless. And you got to have that foundation of health and wellness to be able to lead you into the wild and crazy years when you're 60 and over. And if you're 40 right now going, oh, that's like a million years from now. No, you have no, girlfriend. That's going to be here in the blink of an eye. And you better have a strong, strong foundation. Does that ring a bell?
And education is so important. And we know that like 80% of heart attacks and 80% of chronic problems from diabetes and all are preventable because we just need it's health, it's lifestyle coaching, it's eating the same things that you've been preaching forever, and so have I. Eat right, exercise, sleep well, stress relief, all of those things. And if you don't do them and start early, that, I mean, you can prevent so much disease. It's just that, we don't have the time. I know my mother-in-law, bless her heart. I mean, she was one of the sweetest women in the world. And she had to quit high school to take care of her 10 siblings when her dad died. So did not have an education. And she was my nanny for my daughter, and she was living with me. And one day I'm looking at her, and she was obese, type 2, hypertensive, hyperlipidemia, all those things that metabolic syndrome she would have. And she's drinking a huge glass of orange juice. And I'm like, Mom, what are you doing? She's like, well, orange juice is good for me. It's better than me drinking a Dr. Pepper or a Coke. I'm like, well, I guess it's better from a health perspective, but you're drinking so much sugar there that's terrible for your blood sugar. Oh, well, should I drink milk then? Mom, milk has sugar and fat in it. So it's even just educating, what are the good foods, what are the not good foods? How do you, MDVIP docs will take you food shopping, take you to the grocery store. They'll do events with their patients and walk you through and say, don't look at the things on the end caps, right? Because that's what they want you to buy, what's at the end of the aisle, because it's out there screaming at you. Go to the produce side of things, look at what the ingredients, make sure it doesn't have high fructose corn syrup and all those terrible things. If we could just educate everybody, you and I could live forever and be happy and be like, oh my gosh, they finally listened to us.
I know, seriously. Well, listen, everyone out there in the Her Podcast land, I know why Dr. Andrea Klemes is so passionate about this, because she's actually a board certified endocrinologist, and a lot of her work, both research and practice wise, was done in bone health. And of all the specialties, most people have absolutely no clue as to what's going on with their bones. They're just kind of like, rocking it through the day. They look at their skin, they pinch an inch of their fat, they can flex their muscle, but bone is like, what? I don't know. Well, guess what? You peak bone. In other words, you reach peak bone mass at about the age of, guess what? No, it's not 65. It's 28. Of all the wild things. And so on average, you start to lose some bone mineral density, and it could be a very small amount if you're very physically active. You got good genetics as well. That helps. You're getting good nutrition, et cetera, et cetera. But that's going to continue in an inexorable decline. And then when you hit menopause, it absolutely tanks. And this is why I brought up the issue of estrogen, which is a bone builder. And this is why a lot more of the menopause certified practitioners out there especially are saying, can we talk about menopausal hormonal therapy if you are a candidate? If you have a strong history of heart disease and breast cancer in the family, not so much. This could be problematic, but you need to discuss that with your provider. But, how do you see? This is why when I met you, Andrea, and I saw your incredible background academically, and I saw that, you were a bone health expert. No wonder you have such a passion, because here in that one sector is a phenomenal example of, if you get on it early and lay down a strong foundation, oh boy, will it make your later years, and I mean like after the age of 50, so much better.
So much better. And then monitoring it, right? Because not only do you have to hit the peak, but then you have to know where you are at the peak, checking your bone density in your 40s or so before your menopause, and then continue to check it to make sure, are you losing or you're not? And what can you do, exercise, hormone therapy. And there are drugs to build it up, but I'd rather start with all those natural things that we should be doing anyway. Some things to do to stay healthy. I think we were listing some of them, but golden hints, not just eating healthy, but finding out more of how your metabolism is. Now having continuous glucose monitors you can just buy over the counter. Understand what does affect you, whether it's rice, or whether it's potatoes, or whether it's carbs versus protein versus fat. So that way you can more personalize your nutrition plan and making sure you can try and keep a stable weight. We know exercise is important, but if you're looking to lose weight, it's all about what's going in your mouth. Exercise helps build bone, helps build muscles, helps keep you strong, and helps you metabolize your food. But if you are trying to lose some weight, it's all about what goes in your mouth. Sleep is very, very important. Many people say they don't sleep well. There are a lot of things out there now where you could track your sleep. I'll just put my hand up for a second. That is not my wedding band. I know we both have them.
So we have our Aura rings on. There we go.
I have to say, though, I'm not a really poor sleeper, but having this and understanding what affects my sleep and what doesn't, how much activity I did today, did I have an alcoholic beverage sometime today? In the evening, of course, not before work. But, are all these things affecting me? You add that to your glucose, you add that to your exercise and your basal metabolic rate even. Do you know how many calories? I know you know, Pam, but how many calories do you burn sitting on your butt at your desk all day long? If you know that, you can understand. When I went through menopause, I gained like 20 pounds overnight, I thought. And I got on the scale and my basal metabolic rate had gone from 1,500 to 1,200. 1,200 calories a day is not much of anything. But to be able, because my metabolism slowed down, so I had to cut back on my calories, up my exercise, work on things to bring it back up a little bit so I could lose those 20 pounds that I gained. Luckily, I'm tall, so you didn't really see them much.
I think that your point is extremely well taken. It's, again, laying down that incredibly powerful foundation for health and wellness. So, this has really, really been informative. And I really appreciate, again, your sharing with Her Podcast audience what this brand new trend is, this concierge medicine that's really emerging, both among very large institutions, among networks of physicians like MDVIP, and also among just solo practitioners out there who are calling their practices concierge, and whether they take insurance or not. There's just such a diversity. So you in the Her Podcast audience have to do your homework and really studiously ask a lot of questions and find a good fit here. If it looks as though something like this is attractive to you, and give it a whirl. Do it for a year and kind of see what happens. And, you've got plenty of options out there. So, just get it going one way or the other. All right. Something? I could talk to you forever. So I just want to thank you so much. We have been talking to Dr. Andrea Klemes, and she is the Chief Medical Officer of the largest concierge network in the country, MDVIP. You might want to look it up, scope it out, and thank you so much for being on the Her Podcast.
Thank you so much for having me.
And I want to thank my sponsor, Solar Ray Vitamins, minerals, and herbs rooted in nature, and the new Her Life Stages products. I want you to scope them all out at solaray.com. And hey, take a moment to leave us a review, because we just literally sit around just waiting to hear from you. We really do. The entire team. No question about it. This has been a production of Podcast Health, and I got a reminder for you. Your time in this world may be limited, but the things you can do with that time are not. So get on out there and seize the day. A little carpe diem, everyone. Thanks for listening.